Today's material is a training deck highlighting the top 10 HVAC mistakes that lead to FDA inspection failures, focusing on building a compliant evidence chain. But diving right in, the current risk ranking of the 10 HVAC failure points relies heavily on downstream detection rather than root cause prevention.
Yeah, I noticed that immediately when looking at the slide titled Risk Ranking of the 10 HVAC Mistakes. I mean, the author assigns this numerical score to each failure point to establish a hierarchy, right?
Right, exactly.
And when you look at the top of the list, we see pressure cascades sitting up at a 92 and HEPA integrity at an 88.
High numbers.
Very high. But then if you scan all the way to the bottom, the foundational elements like weak URS, which is the user requirement specification, that's just sitting at 58. And the comfort system mindset is at an incredibly low 52. They're positioned as the absolute lowest risks on the board.
Right. And the argument there seems to be that regulatory inspectors visually catch pressure cascade failures more often during a walkthrough, so they get the higher score. But I usually compare this to, well, a home inspection.
Oh, I like that. How so?
It's like ranking a leaky roof as a critical 92, but scoring a badly cracked concrete foundation as a low 52. I mean, sure, the water dripping on your head is the immediate, visible annoyance that an inspector might write down on a clipboard today, but if the foundation is what will ultimately cause the entire house to collapse tomorrow, scoring it as a 52 seems, I don't know, dangerously misleading?
Completely. And the core weakness here is that by scoring the symptoms higher than the disease, the material implies to the reader that physical, observable failures are the primary target for their compliance efforts.
Yeah, which is a huge blind spot.
Exactly. It completely masks the reality that foundational design flaws are the actual root causes driving those physical failures.
Well, let's unpack the mechanics of that for a second. When the material lists a comfort system mindset at a 52, what does that actually mean in practice for a facility?
So it means the facility is treating a multi-million-dollar pharmaceutical clean room like, well, a standard hotel lobby.
Wow, okay.
Yeah, I mean, a comfort system is designed purely to keep occupants at a pleasant 72 degrees with decent humidity. But a pharmaceutical HVAC system is fundamentally an active contamination barrier.
Right. It's doing a lot more heavy lifting.
Exactly. It uses precise air pressure, massive dilution rates, and unidirectional airflow to physically push microscopic particles away from open product. If an engineering team approaches the design with a comfort mindset, or if they have a poorly defined URS, the foundational blueprint that dictates how the system must perform under maximum stress, that virtually guarantees they will experience a failing pressure cascade later on.
Because, if they didn't specify the correct blower capacity in the URS, the system physically cannot maintain the pressure differential when the doors open.
Precisely. And by ranking those late-stage physical symptoms as critical and the underlying engineering causes as minor, the material inadvertently encourages quality teams to focus on downstream firefighting.
Which is just a waste of resources.
It really is. If I am a quality assurance manager preparing for a 30-day audit sprint and I have limited resources, I'm going to look at this ranking and direct all my team's energy toward checking pressure gauges and watching smoke study videos.
Right, you chase the 92.
Exactly. I might completely ignore reviewing the core design qualification documentation because this deck told me it only scored a 58.
So the suggestion here is to recalibrate or visually stratify the ranking to reflect a chronological or cause and effect relationship rather than just relying on a flat, single-access numerical score.
Yes. The reader needs to clearly see how one failure directly feeds into the creation of the next one.
How do we visually map that out, though, without losing the urgency, though? Could the author bucket these items into distinct tiers, maybe positioning the URS and the design mindset at the base of a pyramid?
A tiered approach is actually a great way to handle it. Instead of a 1 to 10 list, you could create 3 distinct risk buckets based on the facility life cycle.
Okay, I'm tracking.
So the bottom tier is foundational risks, housing the URS gaps and that comfort mindset. The middle tier is operational risks, which includes your pressure cascades and recirculation hazards.
Got it.
And the top tier is monitoring risks, covering building management system or BMS data integrity and periodic reviews. Presenting them this way communicates that you just cannot sustain operational compliance if the foundational tier is cracked.
Yeah, that totally shifts the perspective from a random assortment of errors to an interconnected web. But, if they want to keep the numerical scoring, perhaps they could design a multiplier effect visual,
Oh, that would fundamentally fix the math of the slide.
right? You could visually depict that a comfort mindset-based risk multiplied by a pressure cascade failure equals an unavoidable critical FDA observation. Show the reader that the foundation is exactly what gives the physical symptom its destructive power.
That's a fantastic idea. But even if a QA manager understands that they need to look at those foundational tiers, how do they actually do it in a real audit?
Yeah, that's the real test.
Because if they crack open the tools provided later in the deck, they're going to hit a wall. The corrective playbooks lack the specific investigative triggers that a non-technical quality auditor needs to accurately challenge technical compliance.
I was hoping we would touch on the playbooks, actually. There is a corrective playbook slide for each of the 10 mistakes, and structurally, they all feature a really clean 5-step process.
They look great on paper.
But the weakness lies in the language used within those steps. They rely heavily on broad imperatives. Like in the Return Air Risk Playbook, Step 2 is simply assess hazards. In the Smoke Studies Playbook, Step 1 is define worst case.
Right. And for a highly experienced validation engineer who has spent 20 years mapping fluid dynamics, those phrases probably carry a lot of implied meaning.
Sure.
But the target user for these tools often includes non-technical quality assurance auditors, people whose background might be in biology or document control, not necessarily mechanical engineering.
Yeah, exactly. For them, these steps explain what the ultimate destination is, but offer absolutely no roadmap for how to get there.
Which means the playbooks don't actually teach the auditor how to spot a superficial or incomplete response from an engineering team.
Yeah, it's just too vague.
If an auditor walks into a room, points at a vent, and asks the engineer, "Did you assess the hazards here?" the engineer is simply going to say yes and slide a 500-page spreadsheet across the table.
Oh, totally.
And the auditor is left completely paralyzed without a mechanism to challenge the assumptions inside that spreadsheet.
I have to play devil's advocate here, though. This deck already covers a massive amount of incredibly complex, interdependent technical ground.
True.
If we force these playbooks to include deep technical interrogation, aren't we risking totally overwhelming a non-technical auditor? Sometimes people just need a high-level checklist to keep their heads above water during a stress-inducing inspection.
I see why you'd think that, but I'd argue the exact opposite is true in practice. Providing a granular, highly specific question to ask actually reduces overwhelm.
Oh, really? How so?
Well, the QA auditor doesn't need to hold an engineering degree. They just need to know which specific thread to pull to see if the engineering team's logic unravels. When you give them a broad, nebulous phrase like map flow, you are forcing them to invent the investigative method themselves on the spot. That is what causes overwhelm.
Okay, yeah, I see the distinction now. So the suggestion is to translate these broad playbook steps into specific interrogative prompts that equip non-technical QA staff to probe engineering assumptions effectively. Transform the playbooks from passive statements into active interrogation tools.
Exactly. You want to arm the auditor with scenarios that force the technical team to prove their work under stress, not just in a vacuum.
Let's paint a picture of how that looks on the slide. If we take the playbook for pressure cascades, instead of instructing an auditor with a generic phrase like challenge doors, what should the prompt actually say?
Give them a specific, time-bound scenario. Tell the auditor, ask engineering to document the pressure flow during a shift change at the exact moment when both airlock doors are actively transitioning.
Oh, that's good.
Yeah, that is a highly specific thread. It forces the technical team to prove they didn't just test the airlock doors in a static, perfect environment where nobody is actually moving through the facility.
Because the real risk of contamination doesn't happen when the room is empty, it happens when 30 operators are rushing through the airlock to go to lunch, completely disrupting the positive pressure.
Exactly. The physics of the room change entirely during a shift transition.
Okay, what about the return air risk playbook? How do we rewrite a vague step like assess hazards?
We need to move the audit from a theoretical discussion to a tangible, verifiable proof point. Tell the QA auditor, require the engineering team to pull out the P&ID diagram, the actual piping and instrumentation blueprint, trace the exhaust route with their finger, and point to the exact physical location where campaign segregation occurs.
I love that. And just for the listener, campaign segregation is the mechanism that prevents cross-contamination between different drug batches.
Right.
So if a facility is making a highly toxic oncology drug on Monday and a basic saline solution on Tuesday, you have to prove that the air returning through the HVAC system isn't carrying oncology particles into the saline batch.
Right. And if the engineer can physically trace that segregation point on the blueprint, the auditor immediately knows the system is flawed without needing to understand the underlying math.
That's incredibly actionable. There is also an issue with visual noise on these playbook slides, though.
Oh, the boilerplate text?
Yes. At the bottom of every single playbook, there is a paragraph that reads, Audit-ready output, a controlled document package, trend review, deviations with impact assessment, and approved HEPA effectiveness checks.
Yeah, HEPA being corrective and preventive actions.
Right. Because this identical paragraph is pasted repeatedly across 10 slides, it dilutes the guidance. It feels like regulatory boilerplate rather than a targeted tool.
That real estate is entirely wasted. The author should replace that boilerplate with one unique, hard-hitting question an auditor should ask in a live interview for that specific topic.
Give me an example.
For example, on the HEPA Integrity Playbook, the bottom text could be, live audit question, show me the impact assessment for the last HEPA filter that was repaired, not just the one that passed its annual certification.
Wow. That completely transforms the utility of the training deck. It shifts from being a passive textbook into an aggressive tactical field guide.
Exactly.
But here is the catch. With catching an engineer in a static test, even if the auditor uses these specific prompts to win the argument in the room, it doesn't solve the macro problem. The FDA doesn't just want a snapshot in time anymore.
No, they definitely don't.
Right. When we look at the overarching framework here, the evidence strategies presented do not fully capture the continuous, life cycle-driven expectations mandated by recent updates to EU GMP Annex 1.
This is a critical gap. The deck references the 2022 updates to EU GMP Annex 1 heavily in the beginning, but the execution later on falls totally flat.
Yeah, it doesn't follow through.
Specifically, the weakness lies in the linear nature of the model presented on the regulatory map slide and the HVAC evidence package slide. The deck successfully maps out a very traditional linear evidence chain.
Walk us through what that looks like.
So it starts at requirement, moves to qualification, then to monitoring, followed by deviation, and it finally lands on periodic review. Here, which is exactly how the industry operated 20 years ago. But modern standards demand a holistic contamination control strategy, or CCS.
Right, the CCS is huge now.
Exactly. A modern CCS is fundamentally characterized by continuous feedback loops. The current material fails to demonstrate how operational monitoring data, like an unexpected pressure deviation or a spike in microbial counts, must actively loop back to challenge and update the facility's original design assumptions.
To synthesize this, it feels like the current evidence chain treats traditional GMP compliance like shipping a physical product in a box.
That's a good way to put it.
You design the HVAC, you qualify it to prove it works, you put it in the proverbial box, and once it ships, it's done. You just monitor it to make sure the box doesn't break. But modern Annex 1 compliance, with its focus on the contamination control strategy, is much more like a continuous software update cycle.
That is a perfect framework. It is a living, breathing system.
The initial HVAC qualification is just version 1.0. User data, deviations, and environmental excursions are essentially bug reports. The FDA expects those bug reports to be constantly fed back into the development loop to patch and upgrade the core system to version 1.1, version 1.2, and so on.
Yes.
The HVAC isn't an isolated utility blowing air. It's an integrated, evolving barrier.
Exactly. And the suggestion here is to restructure the visual and conceptual flow of the evidence package to reflect that cyclical contamination control strategy. The author needs to demonstrate clearly how real-world data actively informs ongoing facility design.
I get the philosophy, but visually, how do you map a periodic review, which is inherently a backward-looking historical report, into a forward-looking design change arrow without the slide looking like a confusing plate of spaghetti?
It's all about mapping the outputs. You redesign that linear arrow graphic into a closed-loop cycle.
Okay.
Take the requirement to periodic review progression and draw arrows feeding from the periodic review and the CAPA stage all the way back to the start, pointing directly into design intent and URS.
Ah, I see.
It visually communicates that the end of one process is actively fueling the beginning of the next cycle. You aren't just filing the report, you are using the corrective actions from that report to rewrite the blueprint.
It visually breaks that qualify and forget mentality. And how does that cyclical mindset translate into the text of the playbooks we were just discussing?
The author should add a highly specific playbook step dedicated to integrating HVAC excursions into the site's overarching contamination control strategy document.
Oh, that ties it all together.
Right now, the playbooks treat HVAC findings in total isolation. But if a pressure cascade drifts, Step 5 shouldn't just be fix the blower.
Right.
Step 5 needs to explicitly instruct the reader to formally assess if the site's master CCS document needs to be updated based on this new vulnerability.
That forces the facility to acknowledge that a failure in the HVAC system directly impacts the sterility assurance of the entire building. It integrates the utility into the holistic contamination barrier.
It proves to an auditor that your facility is continuously learning from its own data, which is the exact behavior Annex 1 was rewritten to enforce.
Ultimately, fixing this deck means shifting from a reactive mindset to a proactive one. By stratifying the risk ranking to highlight foundational root causes rather than just downstream physical symptoms, by giving non-technical auditors highly specific interrogation prompts like tracing blueprints rather than generic imperatives, and by turning the linear evidence chain into a continuous, closed-loop Annex 1 strategy, this material transforms from a static textbook into an audit-proof tactical guide.
The core technical knowledge embedded in this material is incredibly robust. These conceptual shifts simply ensure that the knowledge is applied in a way that actually holds up under the pressure of modern regulatory scrutiny.
To our listener who submitted this document, thank you. We highly encourage you to implement these structural updates, and we warmly invite you to submit your revised material back to us for another critique. Because whether you're dealing with pharmaceutical airframes or pouring concrete, no amount of fresh paint on the roof is ever going to save a cracking foundation.